Good evening, CAM followers, and welcome to our CAM Live this evening, where we are very lucky to have two guests. We have the lovely Drew, and we also have the lovely Tom. They'll introduce themselves a little bit in a moment and tell you what they do and why they're going to bounce off each other well this evening. So this evening, our title is Arthritis, Pain and Behaviour, an exploration of the unholy trinity. So in a second, I'll talk through what we're going to discuss this evening and then hand over to these two. But before I do, just would like to show you this video about our member zone. So as you're probably aware, CAM does have a member zone, which is £25 for the year. In the member zone, there is loads of educational videos from Hannah about top tips for owners with arthritic dogs. You'll also find all our previous Facebook Lives. There's helpful tools and resources, which are all free of charge to download. There's discounts in our shop and loads more arthritis tips from our amazing CAM advisors. And lots more. So please head over to our CAM member zone. It also helps keep us afloat and gives us the leg up that we need to keep CAM running and to keep bringing out these new resources for you guys. There's that one. I'd also like to let you guys know that if you're not aware, we are holding our CAM First OA online symposium, which is the 5th to the 7th of April, where we have a whole host of incredible speakers. It is a free of charge event for you guys to attend. It's perfect if you are within a profession where you need CPD. I think it's 14 hours of CPD a day and it's full weekend. So you will get all you need with that. So please head over and book your tickets, and we'd love to see you there. So guys, if you'd like to just introduce yourself, just tell us a little bit about yourself and what you do. So we'll start with you, Drew.
Good evening. Thank you for having me again. I thought you might not be invited back after last time. So, very briefly, my name's Drew. I've been a vet now for, shudder to say this, 20 years, 17 of which I spent in the army doing working dogs. I now work at the Nupsala Musculoskeletal Clinic in Martin Mowbray, and we are a specific service that provides objective gait analysis to baseline mobility in dogs, and then we also use novel intra-articular therapies for arthritis management. So we can do things like stem cells and polymer hydrogels and so forth. So one of the areas of interest that we have is in detection of very difficult to identify lameness. Our equipment is very, very sensitive. And lack of mobility or alterations in mobility is something that we see potentially in behaviour cases, which leads us nicely, hopefully, into Tom.
Yeah, thanks for having me. My name's Tom. I am a certificated clinical animal behaviourist, a member of the Fellowship of Animal Behaviour Clinicians. So I see behaviour cases on veterinary referral in North Lincolnshire and surrounding areas. And alongside that, I'm also studying part-time for my PhD, which is in more of a sort of general animal welfare area, but it has involved a little bit of work on pain in dogs, in one paper that's been published already. So yeah, it'll be interesting to have a chat about sort of combining everyone's expertise to sort of help in these cases.
Fab. Wow, so we definitely have people that know what they're talking about this evening, guys. So if you have any questions, please get them in. But we do have a lot to talk about this evening. We want to get as much information out to you guys as possible. So throughout the live, we will be discussing why animals may react differently to pain, what are common causes of pain, common and less common clinical signs suggesting maybe an underlying pain experience, what is an analgesic trial and their strengths and weaknesses, and finally how vets and behaviourists can work well together. And it's really nice because I know Tom and Drew do work together, so we've got an actual working relationship that you guys can see and how it will benefit you as an owner or a professional. So I think we're going to start with you this evening, Tom.
Mm-hmm.
So why do you feel that animals react differently to pain?
So I guess, well, there's a lot that you could discuss there. Some of it would be, perhaps sort of the Drew could touch on more related sort of types. But from sort of a behavioural perspective, I guess it's useful to maybe highlight 3 areas which might increase the variability in how animals will respond. So one thing we might think about is the animal's underlying temperament. So in clinical behavior, we're often looking at sort of extreme traits in sort of reward seeking, impulsivity, frustration, and anxiety. Now, depending on the sort of profile that the animal has, that might moderate how they react differently to pain. So some examples might be an impulsive dog, if they're in pain, might be more likely to express aggressive behavior much more readily than another dog. Or the anxious dog might be a little bit more sort of withdrawn and avoidant when they're in pain. So, temperament can affect how the animal will express that pain and how they experience the pain as well. Because again, if an animal is very sensitive, they're very anxious, then they are more likely to be experiencing that pain as a more sort of aversive, subjective state compared to the quite sort of emotionally stable animal. Another area that sort of is likely to influence their expression is their learning history. So a good example of this might be the animal who has been in pain for a while and perhaps we haven't sort of noticed it. If they have learnt that they cannot escape, that they can't have opportunities to avoid themselves, then they are going to be more likely to sort of repel people. They're more likely to express aggressive behavior because they've learned that, well, I can't escape this at all. And then perhaps the final thing to mention, which I probably underlooked and not thought about quite as much, is the physical environment that the animal lives in. So in small houses, maybe there are reduced escape routes. Even if we think there's an escape route available, let's say it's a slippery floor, it's a kitchen or a wooden surface, then to that animal that is not a viable escape route.
Yeah.
So if there's reduced space or reduced options for escape, that again can moderate how they might respond in these sorts of situations. And when you sort of take all the factors that can possibly moderate the options available to the animal, that can sort of scale up to create a huge variability in how one animal might respond to being in pain. So I guess that's sort of a brief overview summary of that.
Yeah, no, definitely. It's good, and it's good to look at it from all angles, not just one, and that they don't just present. I think that's the most important thing to get across, is that they don't just present with one behaviour. They don't just become aggressive if they're in pain. So I think that's really important for everyone to realise, that as an owner, you're not just looking out for one behaviour. It could be a whole host of different things.
Yeah, absolutely. And often pain assessment is, or inferring the presence of pain in a behaviour history. It's rarely one single thing that leads us to that inference. It's a triangulation of the evidence.
Yeah,
I
definitely.
think that if I can interject as well, I think it's probably important to bear in mind that pain is a very personal thing as well. So one stimulus can be felt very differently by different animals. Just as it is with people, some people we talk about a high pain threshold. The threshold over which under which you can, it's tolerable, and for other people the threshold is very much less. And I think there is an important consideration there, that threshold is probably something that is also overlooked. So what we think should be painful sometimes isn't, because the animal has a high threshold, or they also, and potentially, Tom, their willingness to exhibit that response is not evident. And so we as clinicians have always seen these cases, the incredibly stoic dog, this incredibly sort of unresponsive animal. You think, God, this has got to be painful. There's got to be something there. That doesn't mean it's not painful, and it doesn't mean there's other knock-on effects from that. It's just that the animals, it's not a binary, you do this and you'll see this response. So I think even between there's that emotional aspect that Tom's talked about, there's the learned aspect, and also a sort of quite a personal physiological aspect as well.
No, definitely.
Right, absolutely. And kind of, rather than jumping the gun a little bit here, but kind of on that point, is I would say, from my experience, in the cases we see that do end up being diagnosed with some form of pain, it's very rare that these animals will react painfully, on examination, because again, we are dealing with normally the more temperamentally extreme dogs. If an animal is very anxious, they are already in a sort of potentially a protective, frozen, sort of inhibited state, and they won't necessarily, react painfully.
Yeah, definitely. Perfect. Thank you, Tom. Over to you, Drew. So what can cause pain, and how do we separate like OA pain from maybe gastrointestinal pain, ear pain, muscular, etc.?
So I was having to think about this, and I thought what might be worth just considering before we kind of get stuck into this one is what is pain? Yeah. I think when we're going to talk a lot tonight about what is painful for this and what we're expecting to see and how we rule that out. And I think we've touched on that it's quite a personal experience, and I've got here a definition from the International Association for the Study of Pain. And now this is a human document. We don't have necessarily quite as a direct translation into veterinary medicine, but it still works to the intent of getting this idea across. And it says that pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So that means it's not as simple. When we're talking about pain, it's not necessarily as simple as thinking, well, that's the equivalent of putting your hand on the hot iron, or that's the equivalent of being punched in the nose and having the immediate pain and then a throbbing pain. There's a whole wrap up here which needs to be explored, and it's not necessarily possible to isolate distinctly what is causing pain in a particular dog. And I think this is where sometimes it's worth taking a step back and taking a much more holistic view and going, what else could be going on? I've got some x-rays that show this is a scenario we often see in the clinic. Got some x-rays, they show mild elbow dysplasia with secondary osteoarthritis change. Great. So let's concentrate on the elbows. We've got those changes there. But actually, over time, there's other things that have happened. And this is in a dog that is in every other way. Let's call this dog normal. It's just got elbow arthritis. So over time, as this dog's gait has changed, one of the things we see is secondary or compensatory gait mechanisms, which can lead to muscular strain. And so sometimes you just need to step back and go, right, before we just concentrate on what I think is going to be the most obvious thing, let's just assess every other system. Let's just make sure there's nothing else we're missing here. Because certainly in over 50% of, and this is anecdotal evidence, but in over 50% of cases of elbow dysplasia with arthritis, there is concurrent shoulder pain. And it's because of the abnormal loading. And you need to address these things, but it's not immediately obvious that one is leading to the other. The other thing that is tricky is determining sort of acute versus chronic pain, and this is where again a holistic view is needed, because you can have lots of things happening concurrently. You can have the arthritic dog that has inflammatory bowel disease. You can have a dog with chronic shoulder strain that has got also atopic dermatitis and periodic skin infections. So you need to note these things down and have them as a almost like a baseline of things that might be painful. And to me, it is better to assume it's painful until you are proven wrong. And I'm happy to be proven wrong in this instance, rather than go, well, it's not going to be that. You know, why would it be? Why would this dog have shoulder pain? There's the arthritis in its elbows, and get seduced down this idea of it's the one thing. So when we talk about what can cause pain, and we go back to that definition of that international definition, it is any stimulus that can cause actual or potential pain. And at its heart, pain is an unpleasant sensory experience that's aiming to take us away from that potential damage. How it hurts, I'm going to try and move away from that stimulus and make it less. Now, that in a disease process, you can't get away from that stimulus, and that's where we then get into this idea of chronic pain. And chronic pain isn't like the acute migraine headache. It's not like the acute sprained ankle. Chronic pain is a grumbling, burning, gnawing pain. It's the pain that keeps you up at night, stops you resting. It's the pain that because you're not resting makes you tired and irritable. And so all these things are linked, I think. And so when it's important to this rambling diatribe I've just done again, I think it's important to just go, before you just rule anything out, take a step back, look at the dog as a whole. Is there anything else that could be causing an issue that I need to account for and maybe treat concurrently with my primary problem?
Yeah, definitely. Going back to chronic pain, a good way of how I can picture it in my head, and Hannah gave me this one. I think she heard it on a podcast, but she messaged me real late at night because she was really excited by it. So imagine you have a big ball of yellow Play-Doh, and then you have a small ball of pink Play-Doh on the side. The pink Play-Doh represents acute pain because it's on the side of the body, and it's there, but it could be pulled off and taken away. Whereas if you smush all that together with the pink and the yellow, the pink takes over the yellow. It takes over the whole body, and you can't get rid of it. It's in there, and it's something you need to manage. And I think that's quite a nice way to understand it as a whole.
I like that. I'm stealing that.
Yeah, do it. I didn't message it to you late at night like Hannah did to me. So, so Tom, moving on to you, could you give us some maybe two little cases of cases you've worked with that have presented in not a common sign that you would associate with pain?
Yeah, so I was having to think about sort of how the best way to do this was, because we could talk for ages about all the possible sorts of signs that might be suggestive or not of pain. But I thought it might be useful to sort of summarize what the most common sort of scenario is that or at least that we see in our caseload. And there's sort of the one, and it's I wouldn't say it's necessarily subtle as such. It's fairly, to me, it's a big sign that this animal is likely to be painful. However, it's probably still, underlooked. And that would be sort of cases where either we have either adult onset or sudden onset changes in behaviour, in particular that lack an explainable cause, or we don't have a sufficient behavioural explanation for. So without sort of going into too much detail, when we're assessing a behaviour case, we have our list of differentials of, possible explanations for the presenting problems. And when we're taking a behaviour history, we are gathering information, lines of evidence that allow us to, on the balance of on the balance of probability say, probably not this, probably not that, it's probably not this. Sort of what are we left with? In some cases, when we do that process, we can fairly confidently get rid of, all behavioral explanations. So even if I didn't have signs necessarily suggestive or supportive of pain, if I see a case like that and I cannot explain this behavior, that immediately to me sort of says, okay, this dog is likely to be painful because something has to explain this, and I can't explain it behaviorally. So some examples of some sorts of cases that I've seen like that are sort of, tail chasing, self-mutilation cases, where the animal has spontaneously started, let's say, chasing their tail, sometimes leading to self-injury. And in those cases, if I said, this isn't behavioral because I cannot explain it behaviorally, then, it's very likely to be pain-related. So, the one I've got in mind, the dog also had a limb amputated, and it took a while and quite high doses of sort of neuropathic pain medications to make the first bit of improvement with that dog, and ended up sort of being referred and suspecting that it was some sort of phantom limb pain in that case. There are other cases where we might see uncharacteristic changes in a dog. So, another one that springs to mind that I've recently seen is a very socially confident puppy who, at around 8 months old, starts sort of growling at people. Now, a lot of people might just put this down to maturity, sort of reaching adolescence, and that's a very easy sort of way to go, it's 8 months old, it's just becoming, an adult, and that's what's caused the problem. But that doesn't follow the developmental trajectory for this dog. A socially confident dog does not just suddenly start growling at people without reason. And, that dog sort of in question also went to see Drew and was also ended up being diagnosed with sort of ruptured crucia and bilateral, if I'm remembering correctly, that is bilateral stifle and hip arthritis. And, that was sort of sent to us as a behavior case. There are other cases, again, where one I worked with Drew on, where the dog was sort of just stopping on walks and apparently acting very anxiously. Now we've got to say, well, what can explain this behavior? It could be that the dog is hearing the noise, it's some sort of noise sensitivity and it's reacting fearfully. It could be that they have a strong preference or sort of go in a particular direction and we're seeing some sort of frustration response. But if none of that is consistent, then again, what can explain the behavior? It might be pain related, and there are several other lines of evidence in those sorts of cases that led us to think that the dog was in pain. And when we got that pain under control, that side of the problem completely resolved. Some other, let's say, common signs, I think it's useful to maybe briefly talk about the predictability of the behavior. So if it's sort of purely a temperamental or emotional behavior problem, we would expect to see a fairly predictable pattern in the behavior. But often, if owners are describing their dogs as sort of moody, Jekyll and Hyde type character, and when you take the history, you might see sort of clusters of events and then nothing for several weeks, and then sort of a cluster of incidences, which is, again, that's not consistent with a temperamentally frustrated dog who, is likely to show aggressive behavior around personal space or resources. We would expect to see that very predictably, very consistently in certain situations. But if we see an element of unpredictability, that's possibly, likely suggestive of pain. Probably, and we don't know for sure, but due to some sort of waxing and waning of pain, which affects the animal. On those days, it's feeling particularly sore. Another one maybe that's useful to mention, which again is, I think, very easy to sort of dismiss as a sort of a behavior thing, is attention seeking. Animals that are a bit sore are likely, again, this is not necessarily every case for every animal. This is just, it can be the case. So, I saw a case not so long ago where the animal was very clingy with one owner in particular. But there wasn't, there just wasn't something right about the relationship. It didn't, the dog would kind of stand or sit on them. The dog wasn't relaxed. There was a bit of tension, panting, arousal, facial sort of tension, and combined with what looked like some gait abnormalities, which the vet agreed with. We suspected that maybe this dog was sort of being clingy for that social support related to chronic pain, and when the dog was on sort of analgesia, we did start to see a reduction. Not a complete, didn't stop doing it completely, but there was a noticeable sort of increase in independence in the dog, which is sort of consistent with why the dog might have been doing that. And yeah, I mean, obviously, there's lots of other signs we could talk about. Could be here all night, so I won't sort of go on. But I would say, those are, that first half of my little ramble there is probably the most common sort of presentation where we might suspect pain. And then there's sort of a couple of other sort of signs there, which I would say are quite potentially common or easily overlooked as indicative of chronic pain. Because just to sort of highlight, yes, in behaviour we don't see acute severe pain, because you don't need to be a behaviourist or a vet or a physio to identify a dog that is in severe, pain. It's pretty obvious. In behaviour we tend to see these low-grade, chronic, waxing and waning type pains.
That's really interesting, and again, it's important to note that it can be so subtle, and it can be just something that you're like, well, that's a bit weird. Why have they started doing that? I know with my dog, the only way that I can tell when she's not controlled with her pain is she starts licking one spot on my front door. That's it's the only thing, and like, people might just be like, oh, I spilt something on the door or something like that. And it's such a weird that it's only because I've literally spent hours like, tell me how.
And that's why keeping, diaries and information, we will often, get clients to keep personalized diaries to help us monitor because we're working with the hypothesis that maybe this dog is painful and we've got to find out. So we'll keep personalized diaries of signs we think might be related to pain. We could be wrong, but, we'll track them. And like even with my own dog, who's got arthritic hips and he's been on pain relief for a while. Before he was diagnosed and went on pain relief, I never would have said that I thought he showed any reluctance jumping. But when he was on pain relief, he went from sort of spending 50% of the time on the sofa and beds and 50% of the time on sort of his bed's on the floor to sort of 98% of the time he was on the sofa and on the bed. So, which I sort of inferring that there was some reluctance to jump there. It just wasn't staring me in the face. And I only noticed it after observing his behavior for a long sort of period of time. And I noticed it because sort of watching and observing animals is what I do, but it would have been very easy to miss that sort of response.
Yeah, definitely.
There's always an element of watching the plant grow or watching the child grow. It's something. Some of these behaviours are quite insidious, and we sort of often see the flip side of some of these behaviours. If we've done, particularly in some where we've done intra-articular therapies, it's very often the cases that we treat aren't lame. They're not limping, they're not showing classic signs of pain, and the reports we get back certainly in the early stages, as the agents are having their sort of initial effects, are, do you know what, he stopped pacing during the night. He's actually sleeping through the night for the first time, or she just seems so much brighter, or she's gone from being behind me on the walks to being in front, or it can be quite subtle things that do change. And Tom, a lot of what Tom gets said is probably like the exasperation cases. It's like, what do we do with this dog? I can't cope with this particular behaviour anymore. But it's important to realise this again, or just remember that these behaviours got massively wide range in terms of variety and also severity. We had one case with chronic lumbosacral disease where there was an unequivocal refusal to accept that this dog had pain. And it didn't limp and it didn't respond to any manipulation. But the one thing it did was, when it was squatting to poo, would raise one leg and start to drag its poo all over the place. Mm-hmm. And as soon as it went on to pain relief, its posture didn't change, but it kept the poo in one pile.
Yeah.
It was a very it seems so banal, it seems such a little thing, but actually, if you think about the stress position the dog has to get into in order to pass stools, it's really painful.
Yeah.
You've got lumbar pain. So it's a really interesting sort of area, and Tom, one of the first cases that Tom and I worked on together was as he said, was really quite a marked avoidance behaviour. She was just very, very anxious, and it took us 25 minutes to get her into the consult room, get her settled in. It took us another 15-20 minutes to even get her on the treadmill. She actually, for a nervous dog, she absolutely bossed the treadmill. She was like it was nothing. She was on it. But then we could actually see the subtle gait changes, and that's what led us to go, you know what, there's something here. There's definitely something here.
And to emphasize that as well, I would say it's incredibly rare that any of the dogs we see are obviously lame or obviously sort of in pain, and not that that's my area of expertise, but that's where sort of the gait analysis that Drew can offer, I think, is so valuable for behaviour cases, because it is really subtle changes. Mm-hmm. And sometimes we don't get anything obvious on the treadmill. Sometimes we do get hints, and it helps us sort of localize things and start building the case, so to speak. But it is really subtle, and it's very rarely obvious.
Yeah, I think you guys are both like highlighting as well why it's so important to work as a team approach, because you're getting two different views on what's going on, and then you put it together, and it helps to get a result, doesn't it? Especially in these tricky cases, like you said, Drew, if they're not presenting lame or an obvious area, it's really useful to have that team approach to get an end result.
Yeah, absolutely. I mean, we can only get so far, and our area of expertise stops, and likewise on the other side, and it's only when everyone comes together that we can sort of really complete things like that case, which is the first one where we got involved with Drew. The routine clinical exam was sort of fairly unremarkable. No obvious lameness, but everything about her behaviour history said this dog was painful.
And interesting, sorry to interrupt there, Tom.
Yeah.
Interesting, in that case, the dog had a pain relief trial. So prior to us examining it, or certainly prior to my seeing it, the dog had a pain relief trial, and it hadn't materially changed things, which makes it really difficult.
Yeah. So leading on from that, Drew, for anyone that isn't sure of like what is a pain relief trial, what actually makes a good pain relief trial, and how does it help to solve behaviours?
So I think first part of this is pick it apart. It's a trial. It's not a therapy. I think this is when we're talking about these cases. This is, and a lot of people feel a little bit uncomfortable with this approach because it sometimes seems a bit overkill, especially if the dog's not limping or not doing those sort of classic signs. The idea of a trial is to effectively see if you have a cause and effect. If I do this, does something change? It doesn't mean that that's what that dog needs to stay on for life. We're not talking about starting up a new multimodal analgesia strategy here. This is a trial, and so for me, if I'm going to start on a pain relief trial, I want to cover off different aspects of the pain pathways to try and hit things in lots of different ways to really it does seem sometimes a little bit sort of sledgehammer to crack a nut or even a warship to crack a nut. Sometimes it's just you've got to hit them quite hard in order to prove the point, which can then lead to the investigation. It might be that the positive response to that pain relief trial is what then allows you to confidently say, do you know what, I am going to submit this dog for an anaesthetic and a radiographic survey, or I am, this has responded to we think it's an elbow. I'm not even going to bother with radiography. I'm going to send this for a CT study because I need to get as much information as possible because I've now got the confidence to say. So for a pain relief trial, it's not just a week of non-steroidal. That's not going to do anything. I managed to, and I wasn't even drinking. I managed to fall over and really, really badly twist my ankle. And I was in really quite significant pain for about 5 months. Taking paracetamol, ibuprofen did not even take the edge off it. It just didn't. And so we come back to that idea of chronic pain and maladaptive pain and all these things. You need the duration of your trial needs to be at least 5 to 6 weeks.
Okay.
And what I tend to do is if I've got concerns about sort of various pathways and chronicity, etc., is I will tend to do a non-steroidal, something that what the non-steroidal is doesn't necessarily matter, because as we know, some dogs will tolerate. So it might be down to tolerability of the drug. Some dogs will take meloxicam, the sort of generic meloxicam drug. Some dogs will be absolutely fine on that. Other dogs take one dose and it's the battle of both ends. Yeah. So you choose something else, just something that the dog can tolerate for a period of time. I'll also often add in something like paracetamol at the same time, and because of the potential for chronic pain, I'll often add in gabapentin into that mix as well. Mm-hmm. And again, not as a therapy, and I'm perfectly aware that the evidence, and we're talking, this is, we've kind of gone into general pain management. This is about sort of arthritis and pain and so on. Mm-hmm. The evidence for gabapentin for pain relief in osteoarthritis is not there. We know that, but it is also undeniably good for chronic wind-up pain and neuropathic pain and sort of, and so as an adjunct to 3 different pathways, I'll often add the 3 in together, as long as, now because you're talking quite a hefty trial initially, if you've got any worries about that, then we'll often say, you know what, I would just do a baseline blood profile. Let's not use this pain relief trial to kick the dog over into fulminant kidney failure because we didn't check. Yeah. So it's just, sometimes it's worth, if it's a young dog and we have no particular concerns, and actually some of the cases we've had in here, you just can't get near, not safely, and in order to take those bloods, you're going to excessively wind up this dog and potentially cause a health and safety risk to human safety. So, do you know what? I'll take a degree of risk on the younger dog, but if it's an older dog and if it's required, then I'll do that. And then recommend that this stays on for consistently for 5 to 6 weeks. It needs to be also in conjunction. So a lot of people will go, right, there's your pain relief trial. I'll see you in 5 weeks. Okay, so take a step back again and assess the patient. Is this patient a calm, collected individual, self-moderating in exercise? Are they going to be just having their tablets and then sitting quietly by the fire, or are they going to be literally doing laps of the ceiling because you're trying to rest them? And so if you're going to do a pain relief trial because you suspect there is something wrong, there's no point initiating that if you don't also address some of the behaviours that might exacerbate that injury. So just for a period of time, it might be worth trying to veer that dog into restricted exercise, diversionary tactics on training. So I talk to a lot of people about certainly for younger dogs doing scent training. Getting them into this idea of, because actually time spent doing scent training, particularly for high drive dogs, is time well spent, because when they do become more immobile, then it's great exercise for them mentally and physically. So I address those aspects as well in looking, where does the dog sleep? Where does this? Try and hit all those aspects. CAM is a fantastic resource about offering up those additional lifestyle changes, the freebie treatments. You need to do those as well. There's no point in starting your dog on a pain relief trial and then taking it down the park and letting it do a 3-hour uncontrolled sprint. That's just you need to define that period and say, right, start, stop. You can use, some people find it useful to use clinical metrics. So actually looking at clinical metrology instruments. So actually have a diary, do a mobility questionnaire, do something at the start, and then again, it's not just is it better? I don't know. It's on Tuesday. It's like, take some parameters, maybe take some videos before and after. Try and capture those things so when you can go back, you can at least have a stab at a slightly more objective. Is it better or not?
Yeah, and I guess just touch on a couple of things there from the behavioural perspective as well. So, in a lot of behaviour cases that have pain contributing in some way, there are strong learning effects. So, sort of classic example would be noise sensitivities, where the noise sensitivity is developed because of an association with pain. Startle response is perfectly normal to a sudden noise, sudden tension of the body. If there's a painful condition there, it can cause pain, and the animal can then learn to become anxious of the noises. Pain is a very powerful thing to an animal. It has to be, sort of evolutionarily speaking, because if it wasn't, then they wouldn't do well at survival. So often, if animals are going to respond to pain relief, it can take a while because there are huge learning effects involved, and it can take time for them to sort of relearn new things in that respect. Because there's just huge learning effects when a dog has come to us who has had this problem normally for at least a few years, which means it's probably been in pain for at least a few years. It's really hard to sort of permeate those learning effects, even if it was pain that sort of started it.
Yeah, no, definitely. Perfect. Right. So I know you guys have written down your myths that we're going to talk through now. But just before we do have a question from Laura, and she's just asked, how long or short can it take for untreated acute pain to be considered as maladaptive chronic pain?
It's a good question. I think the standard accepted time frame is 3 months. So pain lasting longer than 3 months can be considered chronic. Again, doesn't need to be broken leg type pain. We are talking pain of varying severity, fluctuating severity, but anything over 3 months I would consider to be chronic.
Perfect, thank you. So there are a lot of persistent myths that fly around, and they probably are hindering our progression in pain management and what we're able to practice for our pets and for our patients. So I'm going to let you guys crack on with your top 10, which you've got. So over to you.
Yeah, sure. So I think it's useful to sort of mention here that where we kind of got these top 10 myths from is largely from sort of a paper that was recently published by Daniel Mills, Fergus Coots, and Kevin McPeak, called Behaviour Problems Associated with Pain and Paresthesia. So it's a really good paper, as a beautifully demonstrated.
I'm reading.
Yeah, if you could send it over to me, Drew, that would be fab, because then I can put it in the thread after the live.
So it's really useful and really sort of practical paper as well. And so sort of credit to that paper for this. But within that paper, it does sort of talk about common misconceptions about pain, and sort of lends itself nicely to the sort of ending today as sort of a top 10 myths about pain, because they're all sort of very relevant for behaviour. So the first one we've got on the list here from the paper is that behaviour is distinct from disease, and so behaviour problems do not require veterinary assessment. So I guess the thing just to add there from a behavioural perspective is that we know from published caseloads that the sort of estimates of the involvement of pain in behaviour cases ranges from somewhere to sort of 30 to 80%. I mean, even 30% is a worrying sort of number, but up to sort of 80%. In our own caseload, from the top of my head, it's probably about 60-70% of our cases. So it's clearly heavily involved. So it's not as distinct as maybe sort of traditionally thought of. There's clearly an involvement there because we're seeing it, in behaviour caseloads. So Drew, do you want to take the next one?
Yeah, sorry, yeah. Okay. The next myth is that the absence of specific behavioural signs means pain cannot be present. So we've touched on this before about sort of individual variability in terms of, if I crank a leg and the dog doesn't yelp, it can't be painful, can it? There needs to be an appreciation that some dogs are incredibly stoic. Some dogs will give only very, very subtle signs. So it's not necessarily withdrawal, it's not necessarily vocalization. One of the things, we had a dog in recently with quite significant lumbosacral pain, big rangy police dog, and as you depressed the spine, this dog was panting, stopped, started panting again, and it's as subtle as that. So just because they don't yelp, or just because the people don't see what they're expected to see, does not mean it's not painful. You cannot rule out pain based on a lack of response.
Yeah. So we will, on behaviour assessments, obviously, we're not vets, so we're not doing, full examinations and manipulations, etc. But we'll do sort of basic handling just to look for subtle signs of, assuming it's safe. Obviously, sometimes we see we can't do this with, but we'll just handle the dog all over. Are they enjoying it? Are they affectionate, affiliative? And then do we see some slight signs of appeasement, maybe some subtle avoidance in certain areas? That's potentially meaningful, not necessarily, but possibly when you sort of triangulate it with everything else. So the other myth we've got here is willingness to engage in certain activities like play or extended walks means that the animal cannot be in pain. So certainly, in I'm sure in many pain-related cases, you do see reductions in willingness to exercise, and sometimes we will see that, in behaviour cases, sort of reluctance to walk, etc. Although I would say it's generally less common in sort of clinical behaviour problems, because again, we're tending to deal with the more temperamentally extreme dogs. So, if a dog is temperamentally really high reward seeking, very impulsive, is massively motivated to engage in activities like chasing a ball, chasing squirrels, etc., they are going to do that, whether they are in pain or not. They will still be highly motivated to do it. And just because they can do it, it's not evidence to exclude the presence of pain. I've seen cases where sort of collies, who would just do some sort of herding, chasing of a ball all day if they wanted to. Yeah. But when they get home and they're resting and the owner sort of just brushes past or walks past, they get up and bite and snap. Mm-hmm. And the evidence of pain manifests a little bit later on. Just because an animal is highly active and energetic, it's not evidence to exclude.
Next one going on for this one is the absence of obvious or physical evidence from diagnostic imaging excludes painful conditions. So this is one that I often see for early cases. So early cases of osteoarthritis. So again, we need to, when we talk about osteoarthritis and we talk about imaging, you're expecting to see those classic signs. The cauliflower hips, the bony changes, the moth-eaten appearance. That the development of those signs takes an achingly long time. So there was a study, and I hate myself for knowing this, but they actually measured osteophyte development, and it ranged. One of the factors was 0.0036 millimeters a day. So the development over a period of a year was only 0.9 millimeters. So you cannot simply take a set of you suspecting hip dysplasia or pain from hip dysplasia. You take the images. There's no signs of secondary remodeling. There's no osteophytes. You simply cannot rule out pain as one of your differentials. It must remain on there until it's been disproven. Certainly in the early cases of osteoarthritis, where you have synovitis, you've got inflammation of the synovial lining, so you've got pain, inflammation, swelling, effusion, you've got reduced limb function. There won't necessarily be any radiographic signs. So just be careful that just because the X-rays came back clear, that's not ruled out arthritis.
What was the measurement again? Sorry.
I think it was 0.0036 millimeters a day. I've got the paper somewhere, and again, I hate myself for knowing that.
So the next one from the paper is the belief that certain conditions are not painful unless they require surgical intervention. Just to sort of touch on the more sort of behavioural welfare sort of aspect to that point, rather than me touching on sort of the medical side of things, it's just kind of the important point which we spoke about at the beginning, which is remembering that pain is a subjective state that is individual to the animal. And so we need to ask the animal whether they are in pain or not. And that's sort of one of the good things about analgesia trials. That's how I view it from a welfare perspective. It's our way of asking the animal whether they're in pain. Because, we've seen cases, and I'm sure everybody has seen cases where, it's like horrific sort of imaging or something, and but actually the dog does pretty well with, without sort of much intervention, and other cases where we've seen cases and maybe the dog's gone for imaging, maybe there's some mild hip dysplasia, but the dog is doing so well on pain relief, and so it's the individual that kind of tells us how painful they are.
Definitely.
Is that me? So the next one was there's a a blind spot to accepting that abnormalities in young animals can be painful. So this kind of feeds from the idea that arthritis and pain is an old dog disease, and absolutely nothing could be further from the truth at the moment. So the recent studies from a group in the US that did quite a wide-ranging study in terms of the clinical and radiographic signs of osteoarthritis found, we cite this figure, don't we, of 1 in 5 dogs will get arthritis. And that's fine. And the reality is that the figures they were citing in the study was a very worrying 38% in dogs over the age of 1. So 38% of dogs having radiographic and clinical signs of osteoarthritis on imaging and clinical manipulation. So we need to accept that young animals can feel pain too, and coming back to this idea of drive and desire to please and willingness to engage or desire to engage in exercise and do the play activities and do these are not, we need to accept that actually this could still be a painful condition. And it might be, when we're talking about young dogs with hip dysplasia, it might be the dog that just waddles funny. It might just be the dog that's doing something slightly different. And they'll do that exercise because they want to please, and they enjoy it, and it's engaging to them, and it's fulfilling to them. But they'll pay for it later.
Yeah. We had a 6-month-old Cocker Spaniel in the other day, and we ended up doing x-rays, and she has got hip dysplasia, but she came in to have her anal glands done, and the owner was like having a nightmare pulling her hair out because she's been in like every 3 weeks since actually picking the dog up as a puppy. And she's got bilateral hip dysplasia. So it's worrying.
The next one we have on our list from the paper is the belief that pain is inevitable and just needs to be accepted. So, potentially, particularly, people might think that in sort of old animals, commonly hear people say things like, just slow down with age, or there's a bit of arthritis, those sorts of sayings, and I guess, from the animal welfare perspective, I view this from a quality of life perspective and a life worth living. And if an animal is in pain, then, we need to see if we can improve quality of life. What can we do to reduce that animal's pain burden? And sort of in the paper, they touch on sort of, making that benefit to risk calculation for veterinary intervention. And from both sort of from my animal welfare scientist perspective, but also as an owner, I think that, the quality of life side should be very heavily weighted when making that calculation. Because, animal welfare is now more about, a life worth living and good quality of life, not just, not suffering. And if they're in pain, then there is going to be some degree of suffering there.
There's something I cite, and it's something I believe in passionately. That I put into all the presentations I do, and there seems to be this perception among owners and amongst vets is that we need to hold off on analgesia as long as possible. We need to reduce the amount of analgesia we're using. We need to, because of the potential side effects, because of all these things. And my strap line in all these presentations is don't save your analgesia for a rainy day. There is no point saving it for a rainy day if every day up until then it's just going to be drizzly and crap. Yeah. So, as Tom says, it's about quality. We need to, if analgesia was help, give them the analgesia. If there's a worry about side effects, monitor for them. If it is having side effects, then do something about those side effects. But the fear of side effects is not a reason not to give analgesia.
Yeah, I'm going to steal that quote. It's good.
That's me then, isn't it? So the next one, we kind of touched on this a little bit before in terms of, but a short or single course of analgesia did not make an obvious difference, so the condition cannot be painful, or no amount of analgesia will work. And it comes back to this idea, if the analgesia trial needs to be multimodal, it needs to address all of these factors. Not just analgesia is not just about giving them drugs and seeing what happens. Analgesia will it's about, if somebody's got a bum knee or had a knee or had a surgery, what do? You tell them to rest. You need to give the chance. You need to give this trial a chance to work. So just because a short course or a single agent didn't work, as we saw in the case that Tom and I worked on, it just wasn't quite enough. There were other things going on, and the analgesia trial hadn't fully covered all those bases.
Yeah, perfect. That kind of leads on nicely to this question from Debbie Murphy. So she asked, going back to the pain trial, what about when a particular NSAID doesn't appear to be making any difference? Do you stop before the 5 weeks are up and try a different one?
I would always go on for the 5 weeks, and I think we kind of one of the points I think I was going to bring up earlier on, and it's good that this question's come up now. I wouldn't stop just because it's not making a difference or not perceiving to make a difference. It's not therapy. This is a trial. So you need to give it a fair trial. And if you get to the end of that 5 weeks, if you have truly covered the different pain pathways, you could say that, well, you could add in 5 different agents and add in, well, let's start some Librela as well at the same time, and we'll do this and we'll do that, and we'll absolutely, and it's like, okay, then that's great, but then where'd you stop? You need to. I like to define a few parameters around these pain relief trials to make sure that we are hitting them hard, but we're not completely being unethical or just not being sensible.
Yeah.
And the other thing to note is that if we do the pain relief trial, is the behaviour going to go away? And the answer could well be no.
Yeah.
This is complex, and we've talked. Tom's talked really nicely about these dogs' emotional states, their learned behaviours, their avoidance behaviours. That just because you have, hopefully, if not successfully, controlled their pain, but at least you have mitigated it to a certain extent, doesn't mean that all these behaviours are going to go away. There will potentially, or quite likely, be learned components to these behaviours. There could be self-fulfilling aspects. I'm treading on dangerous ground now, so I'm not going to steal Tom's sandwiches here. But if the dog has, by the development of this behaviour, the behaviour itself has got some kind of feedback to the dog that now isn't necessarily linked solely to the pain, that will still require behavioural modification. So the pain relief trial isn't just my dog has suddenly started resource gardening, or suddenly started becoming reactive, or suddenly started belting 7 bells out of my other dog that wants to play with it. I've given it 5 weeks. Well, the behaviour hasn't completely gone away, so that's a fail. Yeah. It's a little bit more nuanced than that. You're potentially, if the behaviour was up here, is it now down here? Have there been other aspects of improvement? If there was a gait abnormality, has that improved? Because that might again give you an idea that something else it's been partially successful to a certain extent.
Yeah, absolutely. And we, sometimes things work out really nicely, and we do get more or less resolutions once the pain is treated. But more often than not, I would say we're looking at slight improvements in it, but there are lots of learned vicious feedback cycles involved that still need behaviorally addressing, so it is, and often we'll see maybe an improvement. If we don't see an improvement in the presenting problem per se, we might see improvement in other non-specific signs like increased playfulness, increased activity, or sleeping better. So maybe we still got a positive result from the trial, and it's like, okay, that's all improved. We're not we haven't got that pain in the background to fight with against quite so much. So maybe our behavioural treatment is going to be a bit more effective because we've got a slightly better handle on that pain side of things.
Expectation management to a certain extent. It's not a magic bullet to make it better.
Yeah. And I guess there's just two sort of quick ones to finish with, which you've sort of already touched on really, but sort of the ninth myth, so to speak, will be that all animals react to pain in the same way. And I guess that comes back to what we were just talking about in the beginning, that sort of interactions between temperament, learning history, the environment, you know, they can all interact and create such large variability in the way that it might present. So we have to really triangulate everything when we're making an inference of pain. You know, not just necessarily expect to see a few sort of cardinal signs.
Which leads us on to the last one, which is pain is all or nothing. And we've touched on that, this idea of pain's not just black and white. It truly is shades of grey. You know, it is extremely complex. It can be difficult to assess. Pain, it can be difficult to isolate different areas, especially if you've got multiple things going on. It might be difficult, you know, the dog that's got chronic pain and has then had an ear flare. Two different pathways going on. It's got chronic OA pain and it's now got an ear flare on top of that. So it is I guess the takeaway message from me is pain's really complex. It's very, very personal as well. It will be different for every case. You can't bracket these into just painful and non-painful dogs. There's a whole range of issues, and so what we try to do, what Tom does with his caseload, and what we try to do here at the clinic is come up with a holistic plan for every patient that covers off all the aspects, not just come in and we'll write a prescription for this and then all will be well. It's much more it's much more complex than that. But if we have, you know, another sort of comment that I have, a lot of people see the diagnosis of osteoarthritis as being the end of the road. That's it. You know, I can't take my dog out for runs anymore. I can't do this. I can't do that. I can't do. It's not. It's the diagnosis of osteoarthritis, especially when linked to behaviour, is just the start of a new road. You just need some guidance initially to start travelling that road smoothly, and then it will come, and then the management will come, and then the quality of life will come, and then all will be well.
Definitely. Well, thank you so much, guys. This evening's been amazing. I've definitely got a lot of take homes myself, so I hope you guys have as well, and I hope you've enjoyed your evening.
Very much so.
Yeah, thank you for having me.
Good, and thank you so much. I know you guys are both super busy, so thank you for taking time out of your day to join us this evening. But thank you for everyone joining us. We are back next week. I think it's next Thursday next week, but keep in touch and it will fly up on your Facebooks. So we'll see you then. But thank you so much, Drew and Tom. You've been fab.
Great. Thanks, everybody.
Thank you.
Bye.
Bye-bye.